and then after that primary went on to do a issue campaign relating to the promise of a single-payer health care. This is an issue that relates very much to me as a physician, having seen how difficult our current healthcare system is, because it leaves people with double indemnity, so to speak. Particularly in pediatrics, you can have a family that's desperate because of a sick or very ill child, and then we add on financial toxicity and the threat of bankruptcy. A father with his child who's been seriously injured or very sick is willing to sell the farm, so to speak, in order to save that child. And this is the catastrophe for our country, that we allow this to happen when other developed economies have solved that problem decades ago. I tried my best to travel around and educate people about the possibility of a single-payer healthcare system. It's even those words thrown together sound somewhat complicated, and in fact, oftentimes that was the feeling that people would have, is, boy, it's such a complex issue. And the issue gets even more complicated because there's all kinds of marketing and ads and almost propaganda that's being produced and flooding our media in order to convince ordinary people to believe that what we have can't be changed, and we're stuck with it even though we're not happy with it. What citizens really want, what all of us really want, is quality health care when we need it and without the hassle. Other societies, other economies have been able to provide that type of health care, and ours can't. And there's a simple reason for that, and that is that we allow too much profiteering, a great deal of profiteering to go on, so that our healthcare system becomes extremely complex, inefficient, and economically unfeasible, and certainly not equitable. And while I was doing that work, I would always ask the people I was engaging with and having conversations, be sure to talk to your representative. It's important that we let our people in Congress know how important these issues are to us, and that we want them to work on a change. One representative has done that. She's the representative of Seattle in Washington State, and she and her crew and her staff and others and many other consultants established fine legislation that's before the 116th Congress now, H.R. 1384. And this is actually a very workable solution for the problems that we face with our healthcare finance. But our congressman would not has not been able to co-sponsor that bill, and it often adds to, that experience adds to the experience of a lot of people feeling that the people who are working for us in Washington, D.C. are not listening very well to what we need and are not responding to those needs directly. Oftentimes we feel like they're working for someone else. Our campaign financing system is very distorted, and it places a heavy burden on our democracy, because people with much wealth and power are able to pay for campaigns that then give them a megaphone voice when it comes time for the work of the people that have been elected.